So we have today with us Deepika, Asra, and Anupriya, who would like to share their work that was published in KAI 2022. So we warmly welcome all three of you. So first up, we have Deepika. So Deepika is a digital futures postdoc at Stockholm University. She works in the field of HCI at the intersection of design and development of novel digital systems that can be tested and evaluated together in the field. Primarily, her research has focused on women's health that has been diversifying from building training solutions for community health workers to designing for intimate health. So thanks a lot for joining, Deepika. Over to you.
Thank you so much for inviting to give a talk here and get, have an opportunity to connect with the community over here. So let me just share my screen. So this work was done during during my PhD, towards the end of my PhD with my IIIT Delhi team. And my co-authors are Kirti, Prerna, Anushka, and Pushpendra Singh. So Pushpendra Singh, I hope you must be knowing about him. He's a professor in IIIT Delhi in Computer Science Department, and I did my PhD with him. And so the title of our paper was, Should I Visit the Clinic? Analyzing WhatsApp-mediated online health support for expectant and new mothers in rural India. So the transition from when you're single to parenthood to pregnancy brings overwhelming changes. And this can be very challenging, and this significantly increases the support needs. And these support needs usually might not get satisfied from one type of source, like the regular visit with the clinicians. And people turn to other sources of support, for example, online health consultation, support groups. But if we talk about the resource constrained settings such as India, especially in the rural areas and underserved areas, there are barriers from the infrastructure and society. So there, the challenge becomes even more, it's very difficult there. If we look into the settings of public health facility, the overload of patient is so high that a single visit with the clinician lasts less than 5 minutes. So this leaves little scope to understand the needs of the mothers and new parents. So in this scenario of challenging healthcare, the recently increased ownership of smartphones by women, like for some women, it is for the first time, it opens new opportunities to think of alternative mechanisms for support. And in this study, we basically analyzed one such initiative by an NGO. This NGO is Swachh in Chandigarh. It is located in Panchkula. So they are using WhatsApp to design digital support groups for expectant mothers, for new mothers, and they are creating multiple support groups based on the stages of mothers. So their large goal is to improve awareness on the importance of first 1,000 days in child development. And through these WhatsApp groups, they provide educational material, and they also help in health problems. So they are basically a team of 8 to 10 moderators, where one of them is a senior pediatrician and others have experience in nursing and social work. So this project started in 2019, and till now they have reached out to more than 3,000 families. So this NGO is also one of the partners I worked extensively during my PhD for my field studies. So when I was doing this study, I was also part of this group because I was also pregnant at that time. So I was motivated to understand how the support, manifests in these kinds of groups. So we analyzed 3 chat groups from these 10, 12 WhatsApp groups. 2 were of pregnant women, and one group was of mothers with newborns. So we qualitatively analyzed their conversation using the lens of social support theory, and basically in the HCI, there is a lot of work around maternal health and women health, mobile technologies. But there is little empirical understanding how and what components of social support theory are sought when alternative support mechanisms are designed. So social support theory has definition and has a lot of frameworks. Social support theory can be of multiple forms. For example, looking for informational support, emotional support, some kind of appraisal support, or a tangible support. So we analyzed these and also did a bit of content analysis to back what we were observing in the data. So informational support and emotional support are the two main forms of support that we observed in the data. And amongst these two kinds of support, informational support was the dominant form of support sought by the participants or the members of the groups. So there were lots of queries, like around 1,000 queries were related to information support. And under this, majority of them, like 75% of them, were related to consultation seeking. So the first, under this consultation seeking, there were primarily three kinds of themes. The first is the use of the groups as a first point of contact. So prior studies have informed that in rural communities, women they have tendency to delay care seeking. And this is more as if we compare men and women, then women tend to neglect their health, and they just go to health service like healthcare clinics when it is like urgent and when they perceive it's a danger sign. So through these groups, the access to experts and the ease of they could talk with the experts at their fingertips through WhatsApp. So it was very convenient for them, and they ask a lot of queries about day-to-day discomforts. And through these discussions, they try to understand about the symptoms of the health problems, and in some cases also discuss about danger signs, for example, onset of labors or some other form of danger sign related to their children or to their health. The second theme was related to the gaps which are there in the healthcare, in rural healthcare. So as we have observed, navigating healthcare during pregnancy or early parenthood itself is very stressful. And if the consultations visits are very short, 5 to 10 minutes, and which makes the patients a little bit unsatisfied. So one of the prominent themes in these conversations was about seeking explanation of their reports, and they frequently mentioned about like their prescriptions. They tried to validate the supplements they were prescribed by their local doctor. And so one of the most common sharing was about the images of ultrasound scan reports. So mother would ask, this is the image, can you please tell me what does it mean? Can you please help me in interpreting this report? So this was one of the most frequent query in the pregnant women groups. And this also points towards the barrier which arise from the high use of technical jargons, and how these reports and diagnostics are usually designed for professionals and not for general user. And all of them are mostly in English language. And so English language is not the language for all in India, especially in rural India. So they might be educated in English, but they may not hold the functional English literacy to understand the technical things in medicine. So this was another theme related to consultation seeking under information support. And the third theme was related to the educational support. So these groups were mainly designed to promote awareness on first 1,000 days. So the moderators would share audio material, and they prompt users to some kinds of question related to their health. So in this population, we have, like, prior studies have informed that awareness about hemoglobin, awareness about body mass index, and all other basic health parameters related to pregnancy and early child development are low. So the frequent discussion and sharing of the material on these topics led to activity where mothers, reported their hemoglobins on their own proactively. They ask about body mass index and a lot of questions related to childhood development, like play and communication, which is generally an overlooked topic in child development. And the second form of emotional support, it was less as compared to information support. The major attraction for these groups was the presence of the pediatrician, the doctor. So everyone wanted to ask their question from the doctor directly, and they wanted to seek solution for their health problem. So there could be multiple reasons for low emotional support. We try to analyze it from two aspects. One is the role of moderation of these groups. So we compared two WhatsApp groups. In one of the group, the doctor took the main lead, and he asked questions from the mothers. How do you feel during pregnancy? So these questions were mainly subjective questions, but the answer of these questions were directly pointed towards the doctor. They were not amongst the group members. So mainly it was like one-on-one interaction with the doctor instead of peer-to-peer interaction. And in the second group, the doctor took the back seat, and the other women moderators, they behaved like the peers and friends, and there the conversation was more informal, and there was a little bit more peer-to-peer interaction, but overall it was very less as compared to consultation seeking and information seeking. And this could be one of the factors that we also observed in the conversation, was that the main focus was on health problems and fetus and child in first 1,000 days, instead of the aspirations of women, and uh, parenting responsibilities. And the second factor could be the limitation which WhatsApp, gives in designing digital support groups. Everyone is included into the same WhatsApp group, and these group members are, they are from one region, from one district, but otherwise they are stranger to each other. And there's also only one channel to communicate. If you have any query, and there's some sensitive information in that query, then there is only one channel. So this could be one of the other factor affecting the emotional support exchange. So in the discussion section, we discuss how these alternative training support mechanisms can supplement traditional healthcare, especially in resource-constrained settings. So these kinds of digital support groups can act as a lightweight manner of accessing to expert and asking questions on day-to-day queries, because the lack of experts is a known problem in healthcare all around the world, and people might not have the resources to access the health facility immediately. Second is, we discuss about the scope for extending clinical help to people. Right now it's very in a very structured manner. You go to clinic and then you see a doctor, and then the clinical help is provided. But here, as an alternative training mechanisms, the mothers, women who otherwise delay care seeking, they could access the moderator, they could access the expert, and talk about their health problems. And unlike other online consultation forums, the moderators here did not shy away from taking part in discussion about the health problems. They allow the group members to call them freely and discuss their problems. And this aligns with one of the studies by Hugh, who argues that redirecting patients to see their doctor in online consultation forum might not be the best strategy always. And we need to think about some collective efforts to help people about in their health problems or related to their anxieties. And the third point of discussion is relationship between the provider and the patient. So in this data, we observe that group members frequently ask explanation of their test reports. So we can think of model where provider is not just one, but a team of providers. So if there is a prescription given by provider which was not explained completely, that prescription can be authentically used by another provider for explanation purpose, for support purpose. So these are some of the directions we can think about. And lastly, we discuss about the trade-off between taking an unplatform approach towards designing digital support groups. For example, in this case, we use WhatsApp, and the NGO is also trying to use other familiar spaces like Twitter to promote their initiative and showcase it and look for collaboration. But at the same time, there are limitations from these tools, and so they are from their need, they also want to design a dedicated platform, which is we call as bespoke platform to provide support to the mother. So it's a trade-off. If you design a dedicated space, a dedicated platform, people might not adopt them, might not install those apps, and maybe it will affect the reachability aspect of the support mechanisms. So this is all I have. I have a very short presentation, yeah, so I can discuss more in the Q&A. Thank you so much.
Thanks a lot, Deepika. This was indeed a very enlightening talk. We can take questions. Is there any questions in the chat?
I have a very interesting topic, Deepika, quite useful also, something like, creating a community platform. I remember talking to one of the doctor. I'm also working in similar area, but of course it's on health and fitness of elderly people in India. So yeah, I have a couple of questions. Like, I want to know about this moderator's role. You said they're all doctors, is that the moderators?
No, one of them is a pediatrician, and others have background in nursing and psychology and social work. Yeah.
Okay. So they're all some domain experts in different areas.
Yeah.
So they're all from Panchkula only, or they're from?
Yeah, most of them are from like nearby areas, Chandigarh or Haryana, Punjab. Yeah.
Okay. Were the participants comfortable in discussing, some sensitive topics? Maybe pregnancy and maternity is always a sensitive topic, right? Were they comfortable in discussing with they were comfortable, is it?
I would say that because the moderators allow the group members to call them. So in general, in groups, you would see normal queries like normal pregnancy discomforts, normal health problems of kids. But if they have something, they want to elaborate, and if there is some sensitive content, then they would call the moderators and discuss it one-on-one rather than putting it on the groups. Yeah.
Okay. These people, these ladies, all are tech savvy. They all had a smartphone before. So they were all using WhatsApp before, is it?
Yes. So because WhatsApp was, is emerging as a popular platform in this population, and that's why the NGOs switched to WhatsApp. Earlier, they were providing one-on-one counseling through like direct phone calls.
Okay.
So now they can connect to the mothers in a group, and they can also share material, and there is media, there is text, and there is audio call. So it's combination of all of these things.
Yeah, only one thing maybe, because the question may be repetitive, right? Because the old questions will disappear. It will go. Yeah. So that is one of the
and also so group members have the tendency to get answered like immediately from the moderators. Even if the question has been answered earlier, they wouldn't scroll up and see the answer. They would ask again, and the moderators have to ask, answer it again. So this is one of the challenging thing for the team. And so they are, they told us, if you can help us and automate this process, that would be wonderful. But it's another direction to pursue. Yeah. All right.
Oh, sorry. Thank you so much. No, thank you so much. Yeah.
Thanks a lot, Deepika, for such an enlightening talk. So next up, we have next speaker, that is Asra. I hope Asra is around. Hi, Asra.
Hello.
Yes. Okay. So Asra is a PhD student at IIIT Delhi in the Department of Computer Science. Her advisor is Professor Pushpender Singh as well. So her research interest lies in understanding how people interact with information technologies in areas with protracted disruptions due to socio-political conflicts. So that sounds like a very interesting topic. Yes, over to you, Asra.
So, hi everyone, I'm Asra, and today I'll present our work titled Hartal Happens Here Every Day, Understanding the Impact of Disruption on Education in Kashmir on behalf of my other co-authors, Divyanshu Kumar Singh and Pushpendra Singh at IIIT Delhi, India. So, education is considered fundamental to human development, and the United Nations Sustainable Development Goal 4 focuses to promote inclusive and equitable quality education and lifelong learning opportunities for all. However, the regions facing ongoing or protracted socio-political conflicts face disruptions to day-to-day activities, and education in these regions is not regarded as an immediate concern and is often overlooked. This work is situated in the context of Jammu and Kashmir, which has been the epicenter of a territorial conflict between India and Pakistan since 1947. And due to this, there have been armed conflicts which have been followed by indefinite curfews, internet and communication blackouts. And moreover, in August 2019, the state witnessed the longest internet shutdown when the government revoked the Article 370 of the Indian Constitution, which granted a special status to J&K. And as an outcome of all of these events, the schools and colleges have remained closed for months over the past decade. And according to the reports, there has been a loss of more than 60% of the total working days in the academic calendar, with 2002 working days lost alone in 2019. And these problems are further compounded by the lack of proper resources and infrastructure. And prior work in the field of crisis informatics has studied disruptions, mainly focusing on natural calamities and disasters, for example, floods, earthquakes. And there also exists work that explores the relationship between technology and socio-political disruption. For example, designing and understanding the use of technologies for healthcare experiences among Syrian refugees in Lebanon, use of technology in daily life during war in Iraq, etc. Studies exploring educational initiatives during disruptions are currently underexplored. While there exists a plethora of research in education for understanding communities and HCI, the challenges faced by the communities due to the socio-political unrest are materially different. And for this work, we engaged in an exploratory study where we sought to understand the following two research questions. That is, how do students, parents, and informal educational spaces support and continue education during disruptions? And what are the different technologies used to impart education, and how are they used during the ongoing disruptions? And for the positionality or the authors of this work or of Indian origin and have prior research experience working with diverse communities in India, I am born and brought up in Srinagar, Kashmir, and have been lived there for more than 20 years. I have the first-hand lived experience of studying on the peak crises, which has motivated us to work in this direction. For this study, we partnered with an organization named Chinar International that has led various educational and socio-economic relief initiatives for more than 10 years in Kashmir. And for the educational initiatives, they closely work in collaboration with the government schools. In August 2019, after the revocation of Article 370, they established community learning centers as informal learning spaces. These community learning centers aim to support primary education for students in the under-resourced communities during these shutdowns. For this ethnographic work, we conducted multiple field visits to understand the multiple stakeholders' perspectives on contextual, cultural, and technological aspects of continuing education with CLCs. We conducted 21 semi-structured interviews at 3 community learning centers with parents, teachers, students, and members of the organization. And we collected the data in the form of audio notes, field notes, photographs, and video recordings with prior permission from the participants. The audio recordings were translated and transcribed to English as necessary for analysis. We used an iterative, inductive, and open coding approach for the thematic analysis of the data. Through our analysis, we highlight our findings in three significant themes. That is the impact of disruption in the daily life and education, the role of CLCs in continuing education, and use, perceptions, and challenges with technology. Through our analysis, we observed that disruption impacted the everyday activities and education of the people. We noticed that education is being politicized in our context, which has instilled and embedded fear, uncertainty, and trauma within the community. And one of the striking outcomes of the disruption is the worsened economic conditions. And this had a direct impact on the education of the children, their long-term aspirations, and the academic infrastructure. As survival in such conditions takes priority and education becomes a luxury and takes a backseat. As one of the participants explained to us, the biggest thing is we're left with no money. And then she went on explaining that there is no arrangement for education when the disruptions are in place. And secondly, we observed the role of community learning centers, which acted as repair infrastructures in overcoming the learning barriers within these contextual constraints. These centers helped in continuing learning activities within the communities where students do not have to travel outside the locality during the crisis. And this model of CLC has instilled hope and faith among the students and parents as these learning centers were able to build a strong foundation among the students, which they lacked previously, as can be seen in a quote by one of the students. I like coming here to this center, and by attending this place for learning, I am sure I'll become something one day. And finally, we observed the use, perception, and challenges with technology. We identified that technology is deeply integrated with the socio-cultural values of families and individuals. There are strong concerns and fear about the children's use of mobile phones, especially the internet. The main concerns are associated with the unintended harms of technology as a tool that could potentially introduce children to the unsafe or the insurgency side of the internet. We also observe the gender and technology roles having a different interplay at homes where daughters are not allowed to use technology, and if they were allowed, it has to be under vigilance. As one of the parents compared the phone to a sword and explained its socio-cultural implications on girls using the devices. This phone is like, if you can use it properly, then that's okay. Otherwise, it ruins your family, your relatives, your community, and yourself. Open YouTube. You'll see there's such things which are not appropriate for a girl to watch. On Facebook also, there's such things that pop up surprisingly, which a girl should not watch. This is the reason why I do not allow without my vigil, because there are things on YouTube and Facebook that a girl should not be watching. Drawing from our findings, we discuss implications for HCI. One is to design with an uncertainty. The core insights drawn from our findings is the prevalence of uncertainty in both the socio-political and the technological infrastructure. The basic assumption of many system designs, such as access to a fast internet or even low bandwidth internet, is challenged every day in conflict-affected regions. And here, we recommend to design with an uncertainty where we not only argue for embracing the uncertainty to better design systems, but also to embed and contextualize it as a platform to design in conflict. We provide two possible design orientations that may help us design interventions. That is by leveraging human techno-infrastructure as a disconnected node. We recommend that when the standalone systems fail to work within the existing infrastructures due to such uncertain events, designers should integrate disconnected mode as a default option into the socio-technical systems. And also operationalizing libraries and caching. To improve access to information, we recommend developing micro-libraries in communities. Researchers from HCI, library sciences, and information sciences should engage in investigating and redesigning tools to manage public library infrastructures better and develop low-cost e-library resources. Secondly, our findings highlight a three-layered relationship between trust and perception of using mobile tech devices within the communities, that is, scientific or health issues, socio-politically shaped safety issues, and socio-culturally shaped community expectations. The lack of trust due to the socio-politically shaped issues such as accidentally clicking on insurgency-related posts poses a significant challenge towards the adoption of the technology within these communities. Therefore, we propose the idea of infrastructuring trust. That is, to not only take security design to the community, but also integrate transparency and literacy about the potential vulnerabilities by leveraging local resources and knowledge. Finally, our findings demonstrate language as a barrier and lack of means or medium to access the relevant material. We noted that students and teachers were using different applications to access learning materials, but the information overload on these applications made it difficult for them to use. Also, Government of India launched Diksha application to provide the platform with curated educational material, but it lacked with its content in Urdu language for the Kashmir board. Therefore, we recommend involving experienced teachers from within the communities like CLCs to generate the locally relevant video-supported educational repositories for a better relatability. We also highlight the need to support offline search and access to relevant content and provide it at a low cost. There are more details in our paper, and for that, I invite you to read our paper, and thank you for listening, and yeah, I'm happy to take questions.
Yeah, Asra, this is Shamshari here. Again, kudos for the talk and the research which you have been doing. My question is, like, given your research, given that there is not how were the educators front? Like, what were the struggles of the educators?
Yeah. So yeah, it's a really very interesting question. So there were struggles on multiple fronts. So when there was the onset of pandemic, there also was the still the aftermath of the revocation of Article 370, and the internet had not been restored. It was completely restored for like after 2 years. So it wasn't there in place. So there was the gradual restoration of internet, and the organization or the educations who they work with are the people who remotely have access to internet, because they are already working with very under-resourced communities who do not have access to all of these internet kind of resources. So the challenges that they faced were many, because the people are socio-economically from weaker backgrounds. So the people or the audiences they were catering to did not have cell phones also, and they did not have access to go to places because restrictions were double. The restrictions were from two ends: the government imposed restrictions and the COVID-19 imposed restrictions. So what they could do in the best of their capacities were that they could locally go and have people in different districts as their coordinators and take the resources to the students. When I say take the resources to the students, is that they used to go to their places and give those resources to them. Yeah, they had a lot of challenges which were not normal in what we saw in COVID with the people who have access to resources.
Great. Thank you again for doing such extremely important work. Yeah.
Thank you, Professor Sanchari. Thank you, Asra. So we have with us Anupriya. So Anupriya is a PhD candidate in the Department of Human-Centered Design, IIIT Delhi. Her research lies at the intersection of human-computer interaction, gender advocacy, equity, and healthcare for development. She identifies herself as a qualitative researcher investigating the role and scope of ICTs for taboo health topics, including mental health and women's health and well-being. So her thesis primarily explores the factors affecting the face-to-face dissemination of menstrual health education and identifies opportunities where technology might be used to encourage and foster communication on the subject. So she is also a trained menstrual educator and works actively with various non-for-profit organizations. Thanks a lot for joining, Anupriya. We are very excited to hear you talk.
Hello everyone, I'm Anupriya Tuli, PhD candidate at IIIT Delhi, India. First of all, I would like to wish you all a very happy World's Menstrual Hygiene Day today, as all of us experience and witness the phenomena in our own very unique ways. And I'm super excited to present this work today on rethinking menstrual trackers towards period positive ecologies. On behalf of my team, in comprising of Dr. Surbhi Singh, Rikita Narula, Dr. Neha Kumar, and Dr. Pushpendra Singh. And this shows I'm a bit nervous, like always. Okay. Yeah. So according to the great German philosopher Immanuel Kant, all persons, regardless of rank or social class, have an equal intrinsic worth or human dignity, which is an innate worth or status that we did not earn and cannot forfeit. However, menstrual hygiene and management advocates across the globe assert on focusing on the safe management of menstruation to avoid shame, embarrassment, and loss of menstrual dignity, where menstrual dignity means menstruators do not have to compromise their basic human rights on the pretext of menstruation. Which leads us to a question: if menstruation is normal and healthy, then why must it be managed to ensure dignity in the first place? So it is this social construction of menstrual dignity that views the menstrual body as a site of reform that needs to be controlled. The HCI literature has critiqued the design of current menstrual tracking technologies for reenacting androcentric ideals by focusing on providing solutions to the same long-standing problem of uncontrolled female body. In this work, we take a stance against the social construction of menstrual dignity by revisiting the purpose of menstrual trackers from being a tool to control the body to a tool to challenge unjust social structures by promoting a shift towards period positive ecologies. We situate our work in the urban settings of Delhi, India, where menstruation has historically been a conversational taboo, resulting in negative period experiences, low self-esteem, and fear of embarrassment on account of menstruation. Our research investigates how menstruators engage in menstrual tracking at different points along their menstrual journeys. What factors affect these choices? Do these tracking practices evolve as menstruators transition from menarche to menopause, making different life choices? And finally, what are the experiences with and aspirations of digital menstrual trackers? To answer all these questions, we take a long view of menstrual journey by engaging with menstruating women between the ages of 12 and 65 years. We began by conducting a preliminary survey to develop a basic understanding of prevalent menstrual tracking practices in our context. Corroborating insights from our preliminary survey and existing literature informed our overall study design. Next, we conducted detailed surveys with adolescents and adults at scale and concurrently reviewed available menstrual tracking apps to curate a set of functional features which were later used in remote interviews as probes. These features included fertility tracking mode, reminders, notifications, symptom logging, etc. Given that we were conducting the remote interviews on a conversational taboo topic, these functional features served as a starting point for discussion while offering a vocabulary to our participants. Additionally, to understand how adolescent menstruators practice, visualize, and relate to menstrual tracking, we also conducted a cultural probe investigation where we used an in-house designed period journal as our probe. The data was collected in both Hindi and English in form of 457 survey responses, field notes, photographs, and more than 19 hours of audio interview recording. The qualitative data were analyzed using inductive thematic analysis and rest by calculating percentages and cross-tabulation. The collected data through different methods were analyzed using triangulation convergence model to outline our findings, which are structured in 4 themes, namely, tracking through the menstrual journey, where we unpacked evolving associations with menstrual tracking through the menstrual journey, that is from early adolescence to menopausal years, which is followed by discussing the innovative methods menstruators leverage to track and interpret their cycles. Next, we unpack the relationships that influence and shape a menstruator's association with their body and menstrual tracking practices throughout their journey. Finally, our last theme presents aspirations of digital menstrual trackers that emerge in our data as participants discuss their experiences with available digital trackers. So I will briefly summarize all my findings, okay? So we observed that menstruators during adolescence viewed tracking as unimportant and did not take their period seriously. For instance, Pihu, while reflecting on her adolescent menstrual years, expressed that it felt like it would feel like a task to her, and she didn't feel it important, so she never took them seriously. While reflecting on their menstrual journey, majority of adult menstruators acknowledged that tracking should be practiced since menarche. However, in practice, they adopted formal tracking if they have a specific reason, like a medical diagnosis, cycle irregularity, embarrassing experiences, or once they are sexually active, as evident in the quote by Jasmine, where she says, except for pregnancy, I don't think there is any value. Your body will definitely alarm you, right? Next, we observe that menstrual tracking has deeper value and meaning in our context. It is seen as a means to an end, where the end is more than just menstrual well-being. Some use it as a guide to be period prepared to avoid stain stigma, as evident in the shared quote by Priya, where she says, her mother, took it on herself to track it down. And she would say, if Papa gets to know it, then it's wrong. So I was always scared that if mom gets to know that I stain, she will scold me. She was so cautious that kisi ko pata na chal jaye. Nobody should get to know about it. There were also menstruators who tracked to feel more empowered in making decisions about their body and life while coexisting with the prevalent cultural stigma. For instance, we observed that unmarried menstruators relied on menstrual tracking as a natural birth control technique. We observed that the menstrual tracking pattern did not change much with transitioning towards menopausal years. 33% of our survey respondents mentioned forgetting to keep track of their cycles in menopausal years. And 16% said that they never even felt a need to track their cycles at all. The ones who tracked their cycles initially continued with their own tested methods and did not track any additional parameters other than the date, given the sporadic nature of periods during menopausal years, as also reflected in this particular quote by one of our participants, where she says, I have kept it in my mind since very beginning. The only thing I struggle to remember is the exact date. That is why I mark it on the calendar. Rest, I feel that feeling hot, which is one of the physiological changes associated with menopausal years, is part of the routine. We observed that informal tracking is the most prevalent approach, where 61% of menstruators across ages reported that they rely on their body as alarm, like that is their memory and physiological changes to track the cycles. Half of our interview participants and 95% of adult survey respondents have tried formal menstrual tracking at some point in their journey. However, only 37% of interviewees reported regularly tracking their cycles, and 21% of survey participants acknowledged often forgetting to track their cycles. It was very interesting to observe that menstruators who are using trackers, be it paper-based trackers or digital trackers, they primarily rely on them significantly to validate their physiological cues and mental calculations, as expressed by this particular participant, where she says, so when I mentally note my period date using some event, then I use a calendar to cross-check the date. And this was one of the most interesting findings of all for us as a team. We also observed that different participants track their cycle very differently. The choice of tracking medium, be it a paper-based or digital-based medium, is driven by convenience, comfort, and experiences with tracking medium altogether. Our participants reported using wide range of these mediums, including the notes application in their phones and also WhatsApp. Few participants logged both the start and the end date, where many were only interested in logging the start date, as evident in this particular quote, where the participant says the main thing is to remember the start date, as rest can be calculated, right? The others took an even more casual approach, where they were only focused on remembering whether they had a period in a month or not. Apart from the cycle dates, our participants rarely tracked any other parameters. And in case when they did, it was just because they were having very severe physiological experiences or symptoms like dizziness, pains in leg, cramps, etc. Currently, the femtech interventions approach menstrual tracking as self-centered and very individualistic. However, our data revealed it to be a highly collaborative process shaped by multiple relationships across generations, which continue to influence their practices and their association with menstruation, starting from prepubescent years to the very later stages of menopausal years. Here, as you can see in this particular diagram, the dashed line represents passive need-based engagement and the thick line represents active engagement. Different relationships play a pivotal role for different menstruators with varying degree of involvement at different points of time. And these might keep rotating and replacing each other with every life transition. Menstruators engage with these stakeholders in their vicinity to primarily seek need-based information and care support. The decision to involve who, when, and to what extent depends on multiple factors grounded in comfort and menstrual stigma. It is this agency which our participants aspired for from their menstrual trackers, as our analysis highlighted specific scenarios in which the design of digital trackers and menstrual data could be used against menstruators themselves. For example, we observed discomfort and apprehension among menstruators across ages in sharing the data about sexual activity, specifically with mothers. This discomfort was rooted in the fear of stigmatized identity. We observed that the most sought after feature is a digital space to construct menstrual literacy. However, our participants described their engagement with such spaces or mobile application or menstrual trackers as predominantly passive and anonymous and being carried out with utmost caution to avoid creating a stigmatized identity. Given the prevalent menstrual stigma, our participants were aware and mindful that their digital footprints and menstrual data could constrain them both literally and metaphorically, as indicated by Jasmine, where she says, I don't think anybody wants to know this thing about like whether you are menstruating or not until you are going to some religious thing in particular, you know, not clean or something like that, that kind of a thing, which unpacks a tension between menstruators' privacy and care support seeking practices. Thus, our participants desire to firmly control menstrual data sharing starting from the initial years of their menstrual journey, what data to share, with whom, and when. Additionally, our participant reported experiences revealed that they aspired a safe space to cater to evolving information needs across a menstrual journey in accordance with the life choices they make, like abstinence, voluntary childlessness, hysterectomy, sexual activity, etc. One of our participants speculated her tracker as an assistant with whom she could discuss her issues and seek advice. In her words, she says, a friend would provide the information I never received. So she equated and imagined a menstrual tracker as a friend, which she never had through her menstrual journey till the point when this interview was conducted. Please do consider reading our paper where we present our findings in much more detail. We analyzed our finding using Martha Nussbaum's capabilities approach, where she proposed a set of 10 central capabilities as a social minimum for an individual to live a life that is worthy of human dignity, thus making it a fitting choice for a study. This approach served as an ally to our participant as it made their struggles of navigating life as a menstruator visible in a context with deep-rooted menstrual stigma. I will now present very consolidated version of takeaways from this study. And I hope that I'm not shooting much of the time given to me. So menstruation, as we observed, is not a one-time occurrence, but an individual journey where an individual's association with menstrual tracking evolves with changing bodies, life choices across different transitions through the journey. Thus, menstrual tracker as a capability building tool call for designing to support menstrual journey instead of designing trackers for a specific transition like menarche, fertility, and menopause. Taking this approach will entail designing for the subjectivity at multiple layers, as it is very evident from the data which I have presented. Throughout the journey, which we have, as a designer, we have to account for the messiness and diverse association with menstrual tracking. Thus, we propose a shift from facilitating designing for our user to facilitating designing for the self, where the design should empower menstruators themselves to first design and later customize their trackers throughout their menstrual journey in accordance with where they are in their menstrual journey, experiences with menstruation, and their life choices, which actually translates to a new opportunities for us as designers to design intervention. That is the process of designing, assembling, and tailoring itself. For instance, the process of engaging the user in designing a menstrual tracker for themselves can be structured as a co-designing activity while preserving the agency of the user to include or exclude stakeholders in their vicinity as co-designers of their trackers. So what will happen in this case is that the design process can facilitate conversation on the subject by serving as an icebreaker itself, or offering a vocabulary and an avenue for activism for facilitating positive body association with oneself and creating body awareness of others. Thank you so much. With this, I really invite you to read our paper where we present our arguments in much more detail, and I'm super sorry if I have exceeded my time limit.
That's okay. That's okay. Thanks a lot, Anupriya.